Hello everyone, this is Dr. Priya here and welcome to New Roots Hair Clinic. So today we are here to discuss if hair transplantation can be done in patients with alopecia areata or not. Other than androgenic alopecia, there are many patients who are suffering from alopecia areata. And after many years of unsuccessful medical treatment, they come to us asking if they can undergo hair transplantation or not. So let's discuss that in today's video, if hair transplantation is an option for patients with alopecia areata or not. But before we move any further, let's understand what exactly alopecia areata is. Well, alopecia areata is an autoimmune disorder which is characterized by partial or full loss of hair. Their initial symptoms include patients will lose their hair overnight in small bald patches of round or oval shape. And the hair is easily detachable if you give a little traction or if you pull out it. And the hairs which are regrowing also will usually appear white in color. The latest treatment available for alopecia areata is autologous growth factor, which is derived by centrifuging patient's own blood, and a mixture of calcium chloride ions are mixed. The patients are responding well with this therapy along with supplements and immune modular treatments. Now let's come back to the main topic, which was if transplantation is possible in patients with alopecia areata or not. Well, I've mentioned this before also. Many of the patients, they do not respond very well to the medical treatment, and patients has to face social phobia, and the quality of the life is also compromised. Well, in milder cases of areata, what happens is hair usually grows back. Hair transplant as an option for alopecia patients can be thought of only when patients have taken the medical treatment first, which includes topical immunomodulators, anti-TNF biological agents, growth factors, etc. The alopecia patch should be stable and not increasing. And also the patient should be aware of the fact that alopecia areata can reoccur, and you can lose hair in that same area or in the other areas also. If the alopecia patch is bigger, or if it is in multiple areas, then in that condition what we can do is we can do a patch test of 100 grafts, and we can wait for 5 months so that it can give us assurance that the results will be in our favor. If the area which is affected by alopecia areata is small and unchanged, then in that case, the first thing that we should do is we should advise the patients to go for a scalp biopsy. And if the scalp biopsy shows no inflammatory changes in the scalp under the skin, then we can consider hair transplantation. However, like I mentioned earlier also, patients should be aware of the fact that alopecia can reoccur, and you can lose your hair again in the same area or the other areas. I hope I was able to answer all your questions in regards with hair transplantation in patients with alopecia areata. I'll see you again in a new video. Till then, please take care.